hydrophilicity test for dental implants was carried out today. Samples were taken out, the chamber was opened, and the samples were placed inside. Before the program was initiated, parameters were adjusted and monitored in real time, and uniform purple glow was observed through the observation window, indicating that the implant, the surface had switched from the hydrophobic lotus leaf mode to the hydrophilic sponge mode. The test adopted the vacuum titration method with strictly controlled conditions. 0.9%. Normal saline and ankle droplets were dripped at a rate of 0.5 ls, and the room temperature was maintained at 25°C. The wettability of surfaces. Plasma-treated implants underwent a significant transformation. The surface of traditional implants resembled waxed glass, where water droplets rolled off upon contact, whereas the treated implants could absorb liquids rapidly like saturated sponges. This property accelerates the integration of bone tissue and implants, upgrading dental implants surgeries from time-consuming healing to rapid stabilization. It makes it easier for surgeons to perform high-difficulty operations and enables patients to not only reduce follow-up visits, but also regain the ability to chew hard foods sooner. More importantly, when hydrophilic implants are placed into the alveolar bone, they will actively adsorb blood and bone cells, just like magnets attracting iron filings, allowing surgeons to achieve excellent primaries stability without repeated repositioning. If you are interested in our products, here is our contact information. Feel free to get in touch with us at any time.